Welcome to the Blanketrol 3 training video, application of Kool-Kits. In this segment, we're going to review the application of the Kool-Kit. Please understand that this is for demonstration purposes only. The patient's probe has not been placed, and we're using a simulator for this demonstration. First, we'll apply the patient vest. Roll the patient onto their side. If you were doing this in an emergency department, you'd roll the dirty sheets up underneath the patient. Roll the patient vest behind the patient's back with the opening ending up around the thoracic spine between T2 and T4. Roll the patient back onto the other side and pull the patient vest through and any other dirty sheets that might be there. Put the chest flaps over the patient and Velcro them down. We want to make sure while we're applying the patient vest that it completely covers the upper vasculature of the chest. The vest should be snug into the clavicles and wrap nicely around the flanks. Once the patient vest has been applied, attach the hose to begin cooling. Be sure to leave all lead wires, leads, and defibrillator pads in place in case the patient needs them at a later point. Next, we'll pre-fill the head wrap. To pre-fill the head wrap, attach another hose from the Blanketrol unit. Gently lift the patient's head to apply the head wrap underneath. Slide the head wrap down to approximately T4 and wrap the head wrap around the forehead. If you have a monitoring device on the forehead, leave it in place. Gently wrap around and Velcro down. Wrap around the neck and make sure the ear is clear. If your patient has an intracranial pressure monitor or they have long hair, you can thread it out the top of the head wrap. If not, close the flaps for a snug fit. Once the head wrap is in place, we're going to apply the lower body blanket. To apply the lower body blanket, place it between the hips and the knees and tuck it in slightly around the legs. Connect it to a hose, with the hose coming out of the side. Once the blanket starts to fill up, cooling has fully been initiated.